Not necessarily knowing what's going to happen in the future creates a great deal of anxiety for many people.
That's according to a sociologist who says texting friends and family isn't enough for your mental health while the COVID-19 pandemic continues. The longer we need to physically distance, the more likely people will be tempted to break these guidelines.
I think a lot of people thought it would be short term, and they had not anticipated that it would be drawn out this long.
Caroline McDonald Harker is a sociologist and professor at Mount Royal University. Her research focusing on how disasters like the Alberta wildfires and the 2013 flood have impacted individuals and families mentally.
People, after experiencing a disaster, often have high rates of mental health. So they experience things like PTSD, depression, anxiety.
Not knowing what's going on or when things will get back to normal can create instability in a lot of people's minds.
Our day-to-day lives involve interacting with other people to some degree. And so when that is completely cut off, that's very difficult for many people to deal with.
McDonald Harker suggests that instead of texting or phoning, virtual connections like video chats can help. This allows us to see people, their facial expressions, and read their nonverbal cues. The COVID-19 pandemic may not impact people's mental health immediately, but McDonald Harker says it can show up years later, which is why it's crucial to address it now and create more resources.
Our mental health impacts our physical health. If we wait and it becomes prolonged, then it's much more difficult to address some of those mental health impacts.
In Calgary, Jackie Perez, City News.